I'm Dr. Nandita Palshetkar, practicing infertility for 30 years. I'm the medical director of Bloom IVF. Today I will be talking about understanding fertility issues. How do you know that you have fertility problems? I think that is a genuine question in everybody's mind. How soon should you approach a doctor? What should you do? So if you are young, if the girl is younger than 35 years of age, then she can easily try for 1 year. And if she doesn't conceive, then she needs to see the fertility doctor. Now, if your age is between 35 and 40, then you should just try for 6 months. And if you don't conceive, you must consult a doctor for fertility issues. And say you've got married late and your age is more than 40 years, then I think you should go immediately to the doctor and just see that you don't have any major problems. So how do we identify that you have major problems? So when a couple comes to me and they've not conceived for 6 months or 1 year, depending on the age of the girl, I would give them some tests to do. So we test the man and the woman. The man, of course, the semen analysis after 2 days of abstinence, meaning it should be at least a 2-day-old or a 3-day-old sample, not a very old sample, and then see whether his semen analysis is normal or not. For the girl, there are many tests, but the basic test that one needs to do is an USG or an ultrasound of the pelvis. That will tell me how the uterus, the ovary, whether the uterus has adenomyosis, whether the uterus has fibroids. Look at the ovaries, see if there's endometriosis or any kind of frozen pelvis, the tubes are adherent, or there's a hydrosalpinx, etc. So sonography gives us a lot of information. The other test that we like to do is AMH of the patient, serum AMH. This is a blood test which tells me the egg reserve. So usually if you've got normal periods, then you don't have to worry too much about hormonal imbalance. But if the periods are irregular, they come after 2-3 months, or they come early, then that is indicative of a hormonal imbalance, and then we have to do a lot of tests for hormones. Usually the basic ones we do is thyroid and prolactin and AMH. But if there is a period problem, then we add some extra tests as well. The other thing that one must remember is checking of the tubes. So we check whether the fallopian tube is open or not. And that is done by either a HSG, which is a hysterosalpingogram, it's an X-ray, or a sonosalpingography, which is done with the ultrasound. Now both the tests are a little painful, but once you know about it, you can definitely do it. And this will give me an evaluation, what is wrong with you and how we can help you get pregnant. I think understanding what is the problem with you is very, very important. So going to the doctor at the right time is very important. So remember, it all depends on the age of the girl. To summarize once again, 6 months if you're above the age of 35, 1 year if you're under the age of 35, and if you're 40, please go immediately and just do some basic tests.